The ovaries stop working at 50, not because hormones aren't good for you anymore, but because women have outlived their ovaries.
Hi everyone, I'm Katana Abbott and welcome to Smart Women Talk. Today we are talking about women's health, hormones, and what it really means to feel vibrant in this next chapter of your life. So joining me is Dr. Jerrold Weinberg, OB-GYN and author of Menopause Mended. His work focuses on helping women restore balance and vitality through bioidentical hormones. Dr. Weinberg, you are my doctor. So we're talking about your book, Menopause Mended. I wish I had found this years ago.
I hear that a lot. What happened was, after 25 years in practice, 25 years ago, I decided I wanted to specialize in some sort of a niche in OB-GYN, meaning I didn't want to deliver any more babies and be up all night, and I wanted to take one small segment of the field and become an expert in it. And my wife said, all those babies you delivered 20 or 30 years ago, those women are in menopause now. And they were just starting something called the North American Menopause Society, which was a scientific group of caregivers composed of OB-GYNs, internal medicine people, primary care people, nurse practitioners, all the people that took care of menopausal women. And it's a very scientific organization. For people interested, they give an exam to become certified as a menopause practitioner, and you get a little pin and a little diploma, and you are put on their website as people who are certified in menopause practice. That's important because, as many women know, menopause does not get the attention it deserves in medical practice. And the reason for it is, when it was first realized 100 years ago that menopause is caused by low estrogens, the scientists had to figure out a way to get women estrogens. And in those days, they didn't have the technology to manufacture the exact estrogen molecule, 17-beta estradiol, which women's ovaries make. So they had to go out into nature and find some estrogenic substance to give women. The only place you can find estrogens in nature is in placentas, meaning pregnant mammals. And pregnant mammals excrete estrogen into the urine when they're pregnant. So they used horses and used pregnant mare's urine. Pregnant mare's urine was shortened to Premarin, which everyone has heard of. And that's what Premarin is. Pregnant cows' urine has estrogenic substance, but it's obviously bovine estrogen. It's not human estrogen, but it worked well enough to make into pills and give to women. They got moderate relief. It came out in the 1940s, but there were side effects. The dose needed a lot of adjustment. There was occasional vaginal bleeding. They realized they had to add progesterone to it, which stops the vaginal bleeding, protects the lining of the uterus. But since it wasn't human estrogen, there were minor side effects like nausea, dizziness, things. But also it came out that there were increased incidence of breast cancer in these women and increased incidence of strokes and heart attacks. To cut to the chase, in 2002, there was a massive study done called the Women's Health Initiative to see whether these Premarin and Provera, was a synthetic progesterone, were healthy. They did not use bioidentical hormones, which had already been invented, meaning the pure human hormones. The Premarin and Provera are made by big pharma, large manufacturing companies. And they stopped the study early because they saw more breast cancer than they wanted to see and more strokes and heart attacks. Careful research showed the reason women got strokes and heart attacks, and it was only a few percent, very small amount, but enough to concern people, was because they were taking the estrogens orally. Normally, your ovaries make estrogens and they go right into your bloodstream. When you have to take the estrogens orally and they have to go through the digestive tract first, they have to go through the liver. And when estrogens go through the liver, they stimulate the liver to make excess clotting proteins in the blood. So these women are walking around with relief from menopause, but a few of them are developing strokes and heart attacks from taking it orally. So it was shown that the way to take it effectively is non-orally. Shots are impractical, but skin patches and skin creams are practical. And that's what we found out about that. In the meantime, the synthetic progesterone, Provera, is what was causing, in a few cases, the breast cancer. So it was determined by using natural progesterone, you prevent that, and that can be given orally.
In simple terms, what is bioidentical hormone? Is it made from plants?
Yes, what they do is they take soy or yams and they add enzymes to them to create that molecule. That's exactly what your body does. It takes a substance, cholesterol, and adds various enzymes to it to design it into bioidentical estradiol. What bioidentical means is it's exactly what your ovaries make. It can't be harmful because all women have been making a lot of bioidentical hormones from the time they go through puberty until menopause. They're making literally gallons, especially when they're pregnant, of these hormones. And they don't get breast cancer when they're 20, 30, 40 years old. So the fact that a hormone that's given after menopause is dangerous is only because it was the artificial hormones that were used. When we use pure estrogen and pure progesterone and give it, especially the estrogen, through the skin, it's exactly like the ovaries started up again.
Oh, that's wonderful. And so you had mentioned cancer, and many people who watch the show have seen former shows where I talked about, I'm a breast cancer survivor.
Yeah.
I had it in 2020, November 2023. And I always share, though, because I do want to tell people this, that I didn't get surgery, radiation, or drugs. I cured the cancer in 7 months by working with a naturopath and just basically complete lifestyle change.
That's more important than even hormone. In any health situation, and I'm sure you speak about this with a lot of people, you have to, and it's the same thing with financial matters, you have to decide you're going to take the initiative and you're going to do it.
Yes.
And then you start to study and you start to ask questions and you understand how to get these things done. And that's one of the things I talk about in my book is how to educate women, because these hormones, these factory-made hormones, the Premarin and Provera were used for so many years, hormones got a bad name. Mm-hmm. There's something wrong with taking hormones for menopause. If you think about it, that's like saying it would be wrong to take thyroid hormone for low thyroid. When somebody has a low thyroid and the doctor says, I'm going to put you on thyroid medication, you say, of course. Menopause is exactly the same thing. The reason women go into menopause is because when the human body developed millions of years ago, people lived to be 20 or 30 years old. Fred Flintstone probably didn't make it to 30, or Wilma. Okay? So there was no menopause in those days because the ovaries are set to last until you're about 50. And the only reason there's menopause now is because we have outlived what nature has created us for, with all kinds of changes in civilization, antibiotics, anesthetics, good sewage, all those other things. People live past that 30 or 40 years. So when they get to the 50 mark, their ovaries stop working. You and I are wearing glasses for the same reason, okay? Our eyes just weren't created to last to what our life expectancies are.
Yeah.
And people with arthritis, people with hip joints, these are all artificial things that we had to invent because we're living longer. The ovaries stop working at 50, not because hormones aren't good for you anymore, but because women have outlived their ovaries. So the idea is you have to give them what they've been making. The reason women go through menopause, the reason menopause is such a difficult time for women, with hot flashes, with night sweats, with severe emotional changes, with all kinds of internal changes like osteoporosis, increased cholesterol, all those other things, is because menopause is an artificial situation, just like low thyroid is an artificial situation. You have to correct when the body stops making what it's supposed to make. And as soon as you put them on the estradiol, and the progesterone protects the lining of the uterus, in a very short time, whether you use a patch, which obviously contains estrogen, which seeps into the bloodstream without going through the digestive system, or you use a prescribed gel or cream, or you have a compounding pharmacist, which is what I do, is have compounding pharmacists make up the estrogen progesterone cream customized for that woman. Now, the reason you don't hear more about compounding pharmacists, I never heard of them before I went into menopausal medicine, is because they're individual businesses. They're not mom and pop stores, but they're small operations that don't have the hundreds of millions of dollars that Big Pharma has to advertise. Big Pharma cannot make compounded hormones because you can't patent them. Because compounded hormones are natural substances you can't patent, like you can't patent water or air.
Or vitamin C.
Or vitamin C.
Yeah.
So Big Pharma can't make it because if you can't patent it, everybody's going to make it and you won't make any money. So the only people that can make these substances are compounding pharmacists, which take estradiol. They order it in bulk, progesterone, cortisone, and they mix cream, if you want it in a cream form, a gel form, a lotion form. They make it up and you take it. And believe it or not, it sounds like it would be real expensive, but it's usually not as much money as some of these prescription drugs are. Anyhow, when you give the woman exactly what she was making in a method of absorption that's absolutely compatible with her body, her menopausal symptoms go away because she no longer has an estrogen deficiency. And you ask, how do we know the right dose? Because estrogen and progesterone are always going up and down through a woman's life. That's why she cycles. There's a range rather than a specific number that you shoot for. A range is very easy to get into. You give the woman a dose which your experience tells you is where you start. And then in 2 or 3 weeks, say, how do you feel? If they're not getting relief, it means the dose is too low. If they're getting relief, you're done. If they're getting too much hormone, they usually get a little breast tenderness. It's not dangerous. It's like when a woman's pregnant and she gets breast tenderness. And we just lower the dose a little and we get it. So it's really very simple. If you go to a healthcare provider and you have menopausal symptoms and this person knows what they're doing, which took me several years to get all this together, and that's why when I wrote the book, it's really a rather simple method.
Didn't you do years and years of research with University of Michigan?
What happened was that was to prove what we did. I was having nurse practitioners mentor with me 3 months at a time. And one of them said, Dr. Weinberg, it looks like your patients do great. Where can I read about this? I said, I really haven't published anything because I haven't had the time and I don't have the, the kind of staff you need to do research. She said, I happen to be a teacher at the University of Michigan in the nursing department. And I wanted to change my career to be a nurse practitioner. But I have access to the research department at the University of Michigan. So I said, okay, let's do a study. And we sent out a questionnaire to all of my patients online, and a questionnaire that was approved by the University of Michigan Research Department. that was thorough and scientific. We collected the information and we wrote up the results of how it was a quality of life study. It was very simple for a woman to answer the questions as to how differently she felt emotionally, physically, etc. on the hormones. And we showed overwhelmingly that these women did exceptionally well. One of the interesting parts of the study, it's being published, it's been submitted to the Journal of OB-GYN Nursing, is emotionally, these women felt an entirely different mindset in terms of power, in terms of their ability to control their lives. That's what they missed most when they became menopausal. And we showed in the study that there was a very strong statistical improvement in these women's feeling of power and control once they got on the hormones.
That's obvious, because if you can stop the night sweats or the hot flashes when you're in the middle of, for women in business, entrepreneurs,
Exactly.
Professionals, and you just start sweating, you ruin your clothes, your makeup completely gets ruined, wipes off, your hair is gross, and you're not getting enough sleep, you're feeling horrible, having a hard time with being tired. All these symptoms are not only going to affect someone at home, but it's going to affect them at work. And so what about the loss? I think I had looked at a number that is costing industry millions of dollars, because women, their productivity and, like you said, their confidence, and even maybe having to take time off. Or
I think it's probably billions, not millions, because any woman that's been through menopause, as far as I know, and I've taken care of 4,000 women, feels differently at work, feels differently all the time. I have a slide that I used to show of a woman surrounded by a lot of lines going out. What is her life like? She's 50 years old. Very likely she has a spouse whom she has a strong emotional relationship with that depends on her feeling good. Usually she's the emotional center of the family, to be very frank. So she has kids that she also has to deal with emotionally. She almost always has a career, and that's an emotional thing. She has financial issues. She has friends. She has a whole other circle, maybe her church, whatever. So she's the center of the family emotionally. And when her emotions are off, the first thing she worries about is, am I going crazy? Second thing she worries about, what's going to happen to all these people? By the way, she's also very likely the primary caregiver for her parents.
I was just going to say that.
And her in-laws.
Yes.
Usually she knows more about her partner's parents than he does. Okay. So she's got all this on her plate. And now she's wondering if she's going crazy. And she's not only wondering for herself, she's wondering what's going to happen to her circle if she's no longer able to help all these people. And that's a tremendous weight. And it's got to do with low estrogen in the brain. And it's corrected by raising the estrogen. And many of my patients have told me that within a few weeks of starting the hormones, they feel like they did before menopause. They got their life back.
Yeah.
That's all they want, is their life back. They
Yeah.
don't want any miracles. They just want to be who they were a few years ago before all this stuff started.
They want to be
And
great friend, a great mom, and if they're married, they want to be a great wife.
and sexually, they
Intimacy.
want to enjoy sex.
Yes, absolutely. So let's talk about some of the symptoms women face, like you mentioned, sex. And I want to talk about the bones, because so we talked about menopause, but then post-menopause. Can the women take, so I'm in my 60s. It's been years. I think it was 58 when I went through, 57, 58. And so now, because I was on the bioidentical hormones, and then I stopped when I had the cancer diagnosis. It's been 2 years now, and I just had another blood test, DNA. I'm still cancer free. I would like to go back on them. I want to see you about that, because when I was on them, my bone density was improving.
Yes.
And I mean, improving. And
That's virtually automatic. When people go through menopause, their bone density drops. Estrogen is necessary for proper bone development. It has to do with the fibrous tissue in the bone, the collagen. When collagen starts to decrease, which is what happens when you lose estrogen, your bones start to decrease in strength, your skin starts to wrinkle, your joints start to get a little bit stiff. There's all kinds of changes from collagen. And there's no question when you start back on estrogens, it's going to have a major effect. There are other things you need to do for good bone health too. Exercise is very important. But there's no question that estrogen dropping causes bone problems. In terms of the brain, there's several different centers in the brain that need estrogen. How do we know they need estrogen? Because there are things in cells called estrogen receptors, which are molecules that catch the estrogen and make them active, like turning a key in a lock. There are estrogen receptors in virtually all the cells of the brain, which tells us it needs estrogen. There are several different centers in the brain. It has to do with the emotions, the centers that are involved with emotions. It has to do with memory. It has to do with libido. There's actually part of the brain. Sexual function is not just in the female organs. It also has to do with the brain, especially in women. Men, there's more of an automatic response. A man can have sex without really being in the right frame of mind. A woman has to be in the right frame of mind to enjoy sex. If a woman has problems with dryness and pain, she's obviously not going to enjoy it, which is going to affect her libido because obviously she's not going to be in the mood if she knows it's not going to be a pleasurable experience. So just to get it, yeah.
bioidentical hormones help with that.
Yes, they prevent, the problem occurs because things dry out from lack of estrogen. And even lubricants don't help because they're on the surface and the dryness is in the lining cells. So a lot of people use lubricants. It only works in minor cases. In major cases where the tissue is really dry, you need to give estrogen either into the vagina through estrogen creams or little inserts, or estrogen systemically. If you take it like in the skin, it goes to your whole body. But if a woman, for example, in your situation, if a woman doesn't want the estrogen to go everywhere in the body because they're concerned about breast cancer, for example, they just take vaginal estrogens, which is not absorbed into the bloodstream. So even oncologists who are a little afraid of giving estrogens to people who've had breast cancer don't mind if they take vaginal estrogens because it doesn't get to the breast area. Just to answer your question before about breast cancer, it's really several separate diseases. There's all kinds of breast cancer derived from different cells in the breast. Some breast cancers are estrogen receptor positive, meaning there are specific estrogen receptors in the tumor that are thirsty for estrogen so they can grow more. Obviously, you don't want to give those people estrogen, but that only accounts for a small percentage of breast cancers. Many breast cancers have nothing to do with estrogen. People have generalized and say, if I have breast cancer, or if there's a family history of breast cancer, I can't take hormones. Family history of breast cancer doesn't prevent you from taking hormones. Because if you have a genetic, let's say that the average person, let's say there's a 20 out of 1,000 chance of getting breast cancer. Let's say in a person who has a family history, there's a 30 out of 1,000 chance of breast cancer. That doesn't change when you go on hormones. That 20 genetically stays at 20 and the 30 stays at 30. You may have a slight increased risk of breast cancer because of your family, but going on hormones doesn't raise it further.
So I think with what you're saying too, with this conversation we're having, everyone, like your book is such a great resource, but everyone should always work with their doctor, have that conversation as well.
Yeah, and you may have to recommend to your doctor that they read the book.
Yeah.
Now, people, when I first started in menopausal medicine, I read Suzanne Summers' book, not because I was looking forward to it. My wife said, if you're going to do menopause and these people are going to come in and ask you about it, don't you think you should have an answer? You need to be able to talk to them about, is she saying anything valid? And I read the book and realized there was a trace of validity in it. And that's how I got into bioidentical hormones. She also said a lot of things that weren't true about a lot of other subjects, as you were selling all kinds of stuff. That
Yeah.
a lot of it wasn't valid, but this was.
Yeah. And so what you're doing is actual medically based. You're an MD.
Oh, it just made me read her book.
Yeah.
Then I went to the library and did an extensive study of what's been written, especially after 2002 when the Women's Health Initiative scared everybody because it didn't use bioidentical hormones, it just used the artificial hormones. And many of the things they did in the study were totally inappropriate, and they've apologized since. They put women on hormones, some women were in their 60s or 70s, to see how they did, women that had never been on hormones. We're dealing with 45, 50-year-old women. That's a whole different population. And they didn't use any of the other hormone preparations besides Permin and Provera in the study.
Yeah.
So these studies were totally invalid. But they made the headlines of the New York Times, July 17th, I think, 2002, and everybody stopped taking hormones. And that's 24 years ago. So people that stopped, and the doctors stopped prescribing them. So even if they went to their doctor and said, I don't believe those studies, the doctor said, I'm afraid to give you the hormones because they cause breast cancer and heart disease and strokes, which wasn't true of bioidentical hormones, but people stopped taking them. That's where the whole controversy came from. So and any doctor that's been trained since 2002 were trained by other doctors who believe the study. So when a woman that goes to see one of these doctors and says, Doctor, I'm having terrible problems, they say, well, I can't put you on the hormone, so you'll tough it out. And everybody that I saw said, I have been to at least one doctor or two or three or four that wouldn't give me hormones. So that's why I wrote the book. So the answer to your question is, you may have to go to the doctor and say, you know what? That's the book. Go buy it, and then we'll talk
Menopause
some more.
Mended.
Yeah. So the doctor may have to read the book because I quote a lot of studies in there that they can look up and see where I'm coming
important.
from. Yeah,
that's important.
So it's not medically based. It's not something that the layperson can't read. But there's enough in there for the health practitioner to read it and go look and see what this guy's talking about.
That's great. And we talked about things like the bones. For women, you just mentioned 60 and 70. So for women because a lot of our listeners are midlife, they're past the menopause. And is this something that we can do at 60 or 70 if we haven't been on hormones before?
Okay. First of all, if you've been on hormones before, stay on them. There's nothing that's been written about any age that you have to stop. Doctors just got the idea, like with any medication that we're trained to use, generally you stop the medication when it's accomplished its purpose. And menopause is such a variable thing for each patient that the doctors didn't know when to stop. So they just said, when your symptoms are done, let's go off it every year or two and see how you do. The evidence is, once you start it, there's no reason to stop. That's number one with the bioidentical hormones. Number two, your question is, what about a woman who's 60 who's never been on hormones? Should she start? I say yes, but it's not going to do as much for you as if you'd started it at 50. because one of the main things estrogen does is it keeps the cholesterol down a little bit, makes your heart a little bit healthier. So once you start on the estrogens, most women are not, especially the bioidentical, you're not going to build the plaques in the coronary arteries. Once you built the plaques and you're 60 and you've had 10 years of no hormones, it's not going to help you as much as it would have if you started them at 50. But in most cases, it still will help with the bone. It may or may not help with the brain. The studies are incomplete about that. But it's still, and many women just feel better taking it.
But if we can also keep our skin better, and the whole idea of cutting out the alcohol or reducing it down a lot, hydrating, exercise, because I'm doing weight training twice a week, and right now I'm in physical therapy, and I'm learning all these great exercises because I had sciatica pain. Now it's gone completely. So I'm going to keep doing those exercises. So if we exercise and eat properly and not do the drinking, a lot of things that happen with women is they get that flabby bat wing thing here or just saggy skin. So I'm wondering if we're on estrogen, is that going to help our skin stay better or our muscle tone if we're exercising?
Yeah, the dermatologist will tell you yes.
Okay.
The other thing is, dermatologists are starting to prescribe estrogen cream for the face. What happened was patients would ask me that, and they'd say, by the way, I started using that vaginal cream you prescribed. I'd started putting on my face a little bit, and there's scientific evidence that it's helpful. I'm not going to say that it's going to change things overnight, but it's certainly becoming a scientific reasonability that estrogen creams may help with complexion and things like that. It puts the collagen back in the skin wrinkles because of lack of collagen, lack of support for the underlying tissue.
Yeah. Wow. Okay, that's wonderful. If women are interested in taking charge and looking into this, what is one thing you would recommend for them to do to take action?
They have to find the right healthcare provider, and there are a lot of ways to do that. One way is to look on the Menopause Society. It used to be called NAMS. Now it's TMS, the Menopausal Society. And I believe the website is menopause.org. They go on that, and there are two sections to the website. One is for healthcare providers and one is for women. And the section for women will list certified practitioners in their area. Nurse practitioners, by the way, are excellent at this. They're better than physicians because they have more time and they explain things better. So you need to find the right practitioner. One way is to do that. Another way is to find a compounding pharmacist near you and ask them which healthcare providers seem to know the most about menopause, because the pharmacist can't give you a prescription until somebody writes it. They will send you to a physician or a nurse practitioner in your area that can talk to you. In fact, a lot of it is done on telemedicine nowadays. As soon as the pandemic started, I started practicing menopausal medicine on telemedicine on Zoom. So there are practitioners in these various, you have to check out the various websites.
You do telemed still today?
Well, I stopped seeing patients a couple of years ago, so I don't see patients anymore.
Okay.
But I've trained many people who are out there, especially nurse practitioners, that now have read my book, and I've conducted sessions with them and how to use the medication and everything. But every area is different. Every area of the country is different.
So the one thing you did not mention is, and the other thing is to read your book.
That's true. Menopause Mended. The full title is Menopause Mended, The Proven Truth About Bioidentical Hormone Therapy, Women's Health, and the Business of Midlife. Just to mention a bit about what does that mean, the business of midlife? I coined an expression, money pause. Money pause to me means all of the people who are taking advantage of women by manufacturing things that sell for a lot of money, a lot of supplements and things like that, most of which don't work. There's all kinds of other things people are doing, changes in their diets, all kinds of things that people are doing that people are taking advantage of. To me, that's all menopause. So I have a few chapters in the book about that. But basically, the main thing women need to know is menopause is a deficiency of estrogen and should be corrected with pure estrogen, and they'll feel great. They'll feel as good as they did before because it corrects the problem, just like taking thyroid for underactive thyroid gland. That's what I want to leave you with.
Okay, wonderful. I appreciate you so much and taking time to be here and we're excited to be part of your book launch.
Thank you very much. I appreciate it.
All righty.
It's good to talk to you.
Okay, and you can get the book on Amazon.
Yes.
That's where I ordered mine.
Yeah, and there's a few other sites. If you go on jhweinbergmd.com, there's a whole website about the book, jhweinberg.com, and you'll see all the information about the book.
Great. Thank you, Dr. Weinberg.
Thank you, Katana. My pleasure.
Alrighty.
Bye.
Thank you. Bye. And thank you, everyone, for coming today. I know you've learned a lot, and I hope that you come join Smart Women by just going to the website, www.joinsmartwomen.com, and you'll know all about our guests. You'll get invited to our events and when we launch programs. So until our next call, go out and live with more purpose, passion, and prosperity.